Hi, this is Dr. Thomas Rocco from Back to Basics CBD Medical Consultants. Today on CBD Health Podcast, I want to talk about the endocannabinoid system. Today, we're going to talk to you like it's a medical consultation I do with my patients interested in CBD. The first thing I do when I see them, I sit them down, we talk about what ailment are they looking for CBD to use as a treatment. Is it for pain? Is it for anxiety? Is it for sleep? Is it for just general wellness? I want to know exactly what they're looking for. And the other thing that's very important to know is, are they concerned about drug testing? Are they concerned about THC? Are they concerned about worrying about drug testing at their employment? So after I know what they're looking for, I like to describe the endocannabinoid system because that really shows the function of CBD. And the endocannabinoid system is a very intricate network of receptors found throughout the brain and body. It's responsible for maintaining homeostasis. It helps with mood and appetite, energy balance, pain perception, and sleep. In the endocannabinoid system, there are two main receptors. There's CB1 and CB2 receptors. CB1 receptors are mainly found in the brain and the central nervous system. CB2 receptors are found primarily in the peripheral organs and all those cells associated with the immune system. And that's important to know because CBD works both on the CB1 receptors and the CB2 receptors. You can't talk about the endocannabinoid system without talking about THC. THC mainly works on the CB1 receptors, which makes sense because it's mainly the central nervous system, mainly the brain. And the reason you get that psychoactive effect or that high from it is because it binds to those receptors. And that's the psychoactive effect explanation. CBD works both on CB1 and CB2 receptors, but it works as an antagonist on the CB1 receptors. And that's important to know because if somebody was using THC and they had too much of a psychoactive effect, CBD can help mitigate those symptoms. But CBD's main effect is the agonist effect at the CB2 receptors. And how it works is it doesn't bind to those receptors. It stimulates those receptors or boosts those receptors so it works better. And that's important to know because you want to start at a low dose and you want to increase CBD gradually to the effect that you need. It's a lot like using fertilizer on your grass. You put fertilizer on your grass, it'll make it greener, it may make it grow better, but using too much of it is not going to make it work or grow better. So with CBD, you want to start at a low dose and increase it as you need it. Just taking a large amount of CBD, you're not going to have much more of an effect to it because it's a bell-shaped curve. The reason behind that is CBD doesn't bind to the receptors. It enhances those receptors to work better. And that's the simple explanation of the anti-inflammatory effect. But it's only going to enhance it to a certain point. The same thing with using fertilizer on your grass. But what's really important to know about the endocannabinoid system is the relationship between THC and CBD. So my next question to my patients is, are you concerned about drug testing? Are you concerned about doing a drug test and having THC present in that drug test? And that happens if you're taking a full spectrum CBD product. There's three main products, but full spectrum has a small amount of THC, which has to be less than 0.3% of that product to buy it without a medical marijuana license. It also has CBD and terpenes in it. Terpenes are the aroma of or fragrance of the CBD, but also has distinct properties for different medical ailments. A CBD isolate is only CBD. It has no THC. It has no terpenes in those products. But I feel because of the relationship of the two receptors, CBD1, CBD2, and THC and CBD, full spectrum medications will get a better effect at a dose compared to CBD isolate or broad spectrum CBD product. And that actually is discussed in 2018. It was the Frontiers in Neurology 2018. It showed that CBD improved mobility with MS patients, and it did it by reducing muscle pain, muscle fatigue, muscle spasms in these multiple sclerosis patients. But what was interesting is they looked at and showed that CBD with THC worked better compared to just CBD products. And that study really shows from 2018 how a full spectrum medication will work better with pain, muscle spasms, with fatigue compared to a CBD product that doesn't have that small amount of THC. What physicians call this is that entourage effect. It's a synergistic effect. And that's why if a patient's not concerned about use of THC and that small amount that could be present on a drug test, I always recommend a full spectrum medication. Side effects for CBD is very important to tell patients. I truly believe that there's very minimal side effects. I rarely see any side effects with CBD. They talk about how there could be diarrhea. I feel that's probably from patients that take too much oil and swallow it rather than getting the absorption of the effect under the tongue. And then that oil acts like mineral oil and has a laxative effect. They talk about dry mouth. But the thing that I'm most concerned about with side effects of CBD is understanding which medications you take and how CBD is metabolized. CBD is metabolized by the liver, by the enzyme P450 enzyme system. A medication that's metabolized similarly is Coumadin. So patients that are on Coumadin, I will tell them there could be an interaction with CBD. We go over all medications that patients take. Specifically, the ones that are metabolized by the liver can be affected by CBD. That's the thing I'm most concerned about with side effects. It's not so much the side effect itself. Is it going to interact with one of your medications? Now, there was a study in 2017 from Cannabis and Cannabinoid Research, and it was an update on safety and side effects of CBD. And what it showed was a review of clinical and animal studies. The results were that there was a better side effect of CBD. The profile was much safer as compared to traditional pharmaceutical medications. So for instance, patient taking Valium for anxiety, they might get a side effect of feeling groggy after that effect of the medication ends. With CBD, the side effect is much less, if anything, none, and there's no grogginess or hangover effect from CBD. So CBD has a very good side effect profile. And the reason I feel that way is because of how it works with the endocannabinoid system. It doesn't bind to those receptors. It enhances and makes those receptors work better. And again, it only works to a certain point. You cannot overdose on CBD, but if you take a lot of CBD medication, it's not going to give you an effect to the point that's too much of the effect. And that's because it can only stimulate or enhance those receptors to a certain degree. Now, talking about CBD and the anti-inflammatory effect, talking about the endocannabinoid system, another study that showed how CBD works with the endocannabinoid system in the central nervous system was a study in 2018 from Frontiers in Pharmacology, and it looked at the potential role of CBD in migraine treatment. What it showed was CBD reduced the cortical excitability and inflammation by correcting it from the improper anti-inflammatory effect of the cytokine production. That increased cytokine production is the reason for our migraine and our acute headaches. And CBD has a role of decreasing that inflammation, helping our symptoms. After we talk about dosing with patients, like how they want to take it, do they want to take it orally, do they want to take it by a tincture, do they want to take it topically, we do talk about dosing. And that's important to know because different doses go with different medical ailments. And so when you look at anxiety dose, I always start at the lowest. For an adult, it's 15 to 20 milligrams of CBD oil. I like to describe it as CBD oil milligrams because it's the end product of all CBD products. For pain, it's 20 to 40 milligrams of CBD oil. And it depends on the severity of the pain. It depends on the weight of the patient. And for sleep, you should start about 50 milligrams, and you may have to increase to 150 milligrams to get the effect of sleep. So it's important for different dosing. There was a study that we have seen on our website. You could read it there. All these studies that we talk about are on our website at www.back2basicsllc.com. That's BAK2basicsllc.com. But this study talked about anxiety and sleep in the Permanente Journal in 2019. And it showed that CBD helped both anxiety and it both helped sleep, but it helped better with patients with anxiety. The problem with the study was the dose was incorrect for sleep, but it was better for anxiety. They were using 25 milligrams, which is better for an anxiety dose. Sleep usually needs a higher dose. So it's important to know what medical ailment that you're looking to treat with CBD and what dose to start. These are all really important things, and it's important to know that I can take it for one thing or another, but the dosing is much different. That's the confusion of CBD, and people don't get that information when they talk to the lay person. So in review with the endocannabinoid system, it's in our central nervous system, it's in our peripheral nervous system, it's in all the tissues that have immune system tissue. It has two receptors, CB1, CB2. THC works on CB1, which it binds to, and that's what causes that psychoactive effect. CBD works both on CB1 as an antagonist, but its main effect is on the CB2 receptors, which is an agonist. My feeling is if you take purely THC medications, it's really for recreational. What makes medical marijuana more medicinal is having THC and CBD, because the CBD will mitigate that psychoactive effect and you'll get more of the medicinal effect from both the receptors of CB1 and CB2. But my feeling is with full spectrum medications that people can buy without a medical marijuana license, they work better because that small amount of THC makes that synergistic effect of CBD and makes the anti-inflammatory properties better. And that's shown again in that study we talked about with multiple sclerosis patients that was in 2018. They did better when there was CBD and THC in their medications. That showed that they decreased their pain, increased their flexibility, decreased their muscle fatigue. So it's important to know how it works by what you're looking for and what type of medications you take. I hope this helped you understand the endocannabinoid system. I hope it helped understand how it works and why it's important to have a small amount of THC in your medication of a CBD product, which will work better. What this does mean is if you use an isolate CBD product or a broad spectrum CBD product, you might need a higher dose to get the same effect you would see in a full spectrum CBD product. Thank you for listening. I hope this helped you understand the endocannabinoid system and how it works with CBD and THC. I do want to put a shout out to one of my favorite wound care nurses, DTI. If you have any questions, please call us at 401-678-6420. Look on our website at www.back2basicsllc.com. Call us for any CBD medical questions. You want to get your information from a physician so you do it safely and properly. Thank you for listening to the CBD Health Podcast. I'm Dr. Thomas Rocco. Call us for any questions medically about CBD. You want to do it properly and safely, and you want to understand the proper dose for your medical ailment to get the best effect. Our phone number again is 401-678-6420. Our website is www.back2basicsllc.com. Thank you for listening.